Myasthenia gravis. Introduction. Which of the following is true about myasthenia gravis? Choose one of the following options. 1. It is contagious. 2. It does not need treatment. 3. It can happen to anyone. Correct. With myasthenia gravis, the immune system cannot tell the difference between helpful and harmful substances. Select true or false. Correct. With myasthenia gravis, the immune system mistakes chemicals on the body for foreign material and attacks them. This prevents messages from the brain from being transmitted to muscles. Which of the following muscles are the most commonly affected in myasthenia gravis? Choose one of the following options. 1. Arm or leg muscles. 2. Breathing muscles. 3. Eye muscles. Correct. But there are a small number of myasthenia gravis patients with no eye symptoms. Is it easy to diagnose the early symptoms of myasthenia gravis? Select yes or no. Correct. Since muscle weakness is a common symptom of many diseases, diagnosis of myasthenia gravis is often difficult in people who experience only mild weakness. Most patients with myasthenia gravis can expect to lead fairly normal lives with treatment. Select true or false. Correct. In some cases of myasthenia gravis, muscle weakness may disappear completely so that medication can be stopped. Symptoms of myasthenia gravis may be life-threatening. Select true or false. Correct. In a few cases, myasthenia gravis may result in respiratory failure, which requires immediate emergency medical care. Myasthenia gravis can lead to some significant disabilities and inability for patients to work or live otherwise normal lives. Thank you for using Explain.